Hello, everybody. Hello, NUHW. You know, this is our favorite weekend of the year because we get to see all of you and you get to see each other. Give yourselves a round of applause, huh?
All right, everyone. It is my pleasure to introduce Gail Pellerin. Gail Pellerin's emergence as a mental health advocate began in 2018 when her husband, Tom Chaffin, died by suicide. At the time, Gail was Santa Cruz County's top election official, but her husband's death challenged her notions about mental illness and forced her to reckon with the challenges faced by so many Californians who want to get treatment but can't access it or afford to pay out-of-pocket therapy. Gail became involved with the National Alliance on Mental Illness and in 2022 ran for state assembly on a platform of improving access to behavioral health care. I'm proud to report that Assemblymember Pellerin is keeping her promise. She joined the Assembly Select Committee on Mental Health, and this year, she teamed up with NUHW on 2 bills that would help all California patients, including those seeking mental health therapy. One of those bills, AB 3221, is now on the governor's desk. It would help the Department of Managed Healthcare better enforce state law by removing roadblocks that have made it difficult for the agency to conduct effective investigations. It has been an honor to work with Assemblymember Pellerin this year, and we look forward to working together to make sure that behavioral health care is something that everyone can access and everyone can afford. Folks, it's my honor to present this award to Assemblymember Gail Pellerin.
How's everybody doing? Welcome to San Francisco. I don't know about you, but that was my first experience with banana ketchup. What do you guys think of that? Leave it to San Francisco. I want to thank NUHW for this tremendous honor. As Sophia said, and my husband died by suicide in November of 2018. It really rocked our world. And my kids as well have had a difficult journey through mental health in their lives as well. And as we all know, the path is not straight, it's not flat, and it's not one direction. And I just want to commend all of you here in the room for doing the incredible work you're doing throughout the state of California. I know we got some folks from San Diego. We got Oakland Children's Hospital in the house. Lots of people throughout the state. I just want to really hats off to you and thank you for all your work, because I know this is a very difficult field to work in. And I jumped at the chance when NUHW came to my office and asked if I would carry your 2 bills. AB 3221 and AB 3260. And unfortunately, AB 3260 ended up in the Senate suspense file. And as you all know, DMHC put out crazy numbers on what these bills were going to cost, and it just tanked the bill. And so we're going to fight back next year and come back with that bill with factual numbers, and we're going to get it to the governor's desk, mark my word. And I just want to thank Benjamin Eichert for your many hours spent on the bill language to get it just right. Julie Nielsen for her work building and mobilizing the coalition. Rhiannon Mulligan in my office, who has staffed the bills. And just a shout out to Sal and Sophia for your leadership with NUHW. Because everybody deserves access to reliable and affordable mental health care. So can I let you in on a little secret? Pinky swear it doesn't leave the room. I got a call from the governor's office. AB 3221 was sitting on his desk. And he said, wait a minute, I heard Gail's going to NUHW tonight. I better give her a signature on her AB 3221. But that information's embargoed until the press release goes out. But I was allowed to share it with all of you tonight. So it is worth every pound of sweat, every sleepless hour, every knock on every legislator's door, every phone call. It takes a village to pass these bills, and I am with you 100%, and I just appreciate the honor of being here and look forward to working with you next year as well. And remember, gotta say one more thing, because we got something very important coming up in November. And when we vote, we win! So I want everyone here in this room to promise that you are registered, that you're going to vote, and I want you all to promise me you're going to talk to 5 people and make sure they are registered and voting in this November election, because it is critical that we get the votes out and we elect the right woman to the presidency of the United States. Thank you all very much.
Wow. So folks, State Senator Scott Wiener has a reputation for taking on big challenges and passing difficult legislation. He's a leader when it comes to increasing housing production and protecting the rights of LGBTQ Californians. And his record is unmatched when it comes to advancing parity for mental health care. In 2020, Senator Wiener offered SB 855, which greatly expanded the rights of Californians to access medically necessary mental health and addiction medicine treatment. This new law requires health plans to provide medically necessary care for the full range of mental health and substance use disorders recognized in the standard clinical manuals. This new law requires health plans to use appropriate criteria for determining when care is medically necessary and arrange out-of-network care when timely in-network care is not available. The following year, Senator Wiener worked with us to pass SB 221, which requires health plans to provide medically necessary return appointments within 2 weeks, not 4 to 6 weeks, which is uncommon in Kaiser Permanente. And in 2023, Senator Wiener authored SB 770, which laid the groundwork for California to potentially become the first state to adopt single-payer Medicare for all healthcare system. And I'll tell you, this bill was very controversial among his colleagues for political reasons that I'm happy to share with you offline. But you know, he had worked so hard for us the previous year. We went to a number of other friends to ask them to carry this bill, and they didn't have the courage to do it. And 36 hours before the deadline to find an author, I went to Scott, and he immediately said, I'll take it on. It's going to be tough, but we'll do it together. That's the kind of leader Scott Wiener is. You know, we have a saying in our union, right? And that is when it comes to elected leaders, we don't have permanent friends, and we don't have permanent enemies, we have permanent issues. But you know, there's exceptions to every rule, because Scott Wiener is a permanent friend of NUHW. On behalf of all of you, I'm very proud for our union to present this award to Scott Wiener. Please, Scott, join us.
Thank you, Sal. Let's hear it for Sal Rosselli. I've known Sal for a very, very long time, before I was in elected office. And the thing about Sal is not only is he a brilliant labor mind, but he's a brilliant political mind. And he understands how politicians, how elected officials think, and some of our neuroses and all that kind of stuff. And so Sal has been just such a good friend to work with, but also helping me navigate some very difficult issues at times in the world of labor, which is it's a very complicated world. So Sal, thank you for everything you do for the community, for your decades of service to the labor movement and to San Francisco. We are also deeply grateful. Thank you. So I'm so grateful for this award, and I'm a huge, huge fan of NUHW. This is not, NUHW is, you are not the biggest union, but you are among the mightiest. And you show it day in and day out. It's been an honor to stand with you on the picket line at Kaiser. It has been an honor to lock arms with you in passing the bills that Sal mentioned, and they were all hard, let me tell you. They were all, every single one of them was a huge, huge fight, and sometimes uncomfortable fights. The last one, the single payer bill, it was uncomfortable, but ultimately it was the right thing to do, and we got it done because NUHW just went to the mat, and we went to the mat together. So thank you so much for that. And then the last thing I just want to say is that the work that we've done together, so much of it has centered on mental health and addiction treatment. When I go to stand on the picket line with NUHW, I'm doing it in solidarity with the union and with the workers. But the beautiful thing about it is when NUHW is striking because of lack of access to mental health treatment, it's not only about working conditions and wages and benefits. Of course, it is about that, but it's also because this union cares so deeply about the health of the patients for whom you all care. And when we look at the amount of suffering that's happening right now because of the lack of access to mental health treatment, because this country for so long has taken the attitude that mental health treatment is it's a luxury. It's a luxury add-on. Or just snap out of it. It's a personal failure, right? It is this bizarre societal attitude about mental health and about addiction that just makes no sense. And we know now that this is something that needs to be treated. And the work that you are doing is saving lives. It is absolutely saving lives. The work that we do together and that Gail Pellerin does to expand access to mental health treatment, it is saving lives. So thank you so much for standing with us. Thank you so much for your support, and thank you so much for always doing what's right. Thank you.
I'm really falling for these people, you know.